This paper is about deploying AI models using the MONAI deploy framework in medical imaging ecosystems. What I mean as a medical imaging ecosystem is a clinic or a hospital and the associated infrastructure. Nowadays, there are more AI models that are developed, but very few of them reach the end user who are the patients and radiologists. The reason being that most of the models are developed and tested in a very controlled environment and with very curated data set. They fail to either perform at the same level of accuracy when deployed in a hospital, that is, if they are deployed. Plus, there is a huge overhead cost associated with such deployments. Another reason for such obstacles in the deployment process is the datasets used in training are either in Nifty, JPEG if they are 2D, or NumPy image formats. Such datasets are not native to a clinical infrastructure. These datasets in clinics are comprised of DICOM, which is a fairly flexible imaging standard used in hospitals. This flexibility often makes it difficult to handle such images. In MONAI, we have standardized all the imaging protocols and given open source tools which can be modified by the user to design their own tools. Such open source framework also allows us to standardize the model sharing and reusing of components of the deployment infrastructure. The current MONAI framework allows for model training and inference using the DICOM imaging format on raw medical data. It also provides us tools to wrap the results of DICOM compatible formats like DICOM structured report and DICOM seg. It is important to produce results in these formats for them to be consumed by the rest of the clinical infrastructure. As you can see in the figure below, it shows a typical hospital platform and the communication pathways. A typical clinical platform is comprised of clinical workstation, electronic health records, also known as electronic medical records, hospital information system or HIS, or radiological information system or RIS. This is followed by the image scanner, DICOM router, the PACS or the vendor neutral archive for images, storage and visualization, followed by the radiologist workstation. The figure shows these components and the messages that are passed between these systems. From a clinical workstation, a clinician orders a imaging study which is communicated to the patient's electronic medical records and a scan is scheduled. When a scan is completed, the imaging study is forwarded to the PACS for storage and display through the DICOM router. These images are then viewed on the radiologist workstation, where the radiologist can either accept or reject the AI results. Most people think that this is the only place where AI is used. However, in the figure you can see that all the green icons are the places where AI can be used for improving the clinical workflow. MONAI Deploy is working on and providing such endpoints for deploying AI models. Thank you very much for your attention. Thank you.